Webinar starts.
Hello everyone, welcome to this webinar on scaling or growing of innovation in adult social care. There's a number of things I should warn you that could go wrong in this webinar. I'm broadcasting from Doncaster. We've got colleagues from Leeds, from Cheshire, from Camden in London, all trying to contribute to this webinar. But through the power of technology, I hope we survive through to the end of the session. And if one of us does fall offline or one of our kids comes in and disrupts us, then I'm sure our colleagues will step in and help us. Anyway, welcome to the webinar. What we're going to do today is discuss the latest evidence, the latest insights on how we support the scaling or the growth of innovation in adult social care. It's actually a very good time, I think, to be talking about innovation in adult social care. As we emerge from what is probably the most difficult period social care has faced in many years, I think it's a good time to think afresh about how we support some of our most promising, innovative approaches to care and support to grow and to prosper. And as we come out of this crisis, I think we will face significant demand on services, and unfortunately, there will still be a shortness of money available to support innovation. So we're going to have to be really creative about how we put in the conditions, the structures, the processes in place to enable the very best models of care to grow and to thrive. So we're going to be talking about this for the next hour. In terms of introductions, I'm Ewan King. I'm the Deputy Chief Executive of the Social Care Institute for Excellence. And I'm really pleased to be joined by some really great speakers who will offer a range of perspectives on innovation in adult social care, and particularly how we go about putting in place those conditions I've spoken about already that support the growth of innovation. So I'm going to be joined by Alex Fox, Chief Executive of Shared Lives Plus, who's going to talk a bit about the Social Care Innovation Network, which has just come to the end of phase 2 and has produced a range of tools and resources which I think the sector will find helpful. He's also going to talk a bit about his experience of growing shared lives schemes across England, a really very successful model of care that I think has brought about improved outcomes for very many people. He will be joined also by Kate Sibthorpe, who is a person with lived experience, looks after her daughter, and will be coming at this from a perspective of someone who receives care services and wants good care services to grow. We'll also be joined by Sam Callanan, who will be talking about new research we published today, sponsored by the School of Social Care Research, about what evidence there is to support, what evidence exists about how we support the growth of innovation. And we'll then finally be joined by Juliette Malley, who is from the London School of Economics, who will be talking about early insights from a 5-year program that she is running, looking at how we grow innovation in adult social care. So it's a really broad range of perspectives, and hopefully it will create a really thought-provoking and interesting debate. We will try to leave as much time as possible for questions, and do start posting your questions and your thoughts and your comments now, and we'll try to pick up and respond to those when we open up for questions a bit later on. Just to tell you also that we will be recording the webinar and the slide decks that go with the webinar and posting those on our website within the next couple of days. So hopefully I can stop talking now, and my kids haven't disrupted me, so we're doing well so far. I'm going to hand over to Sam, who's going to talk us through the research that's just been published and will be available on our website shortly. Thank you.
Thank you. Hello, everyone. Thanks. If you can just move us on to the next slide, please, Natasha. Okay, so I'm going to tell you just a little bit about this rapid pragmatic review of evidence we've done. It was a kind of small-scale piece of work funded by the NIHR School for Social Care Research, so thank you for them for that. And we were focusing on evidence since 2015 because that's when the Care Act was enacted. So we're looking at kind of recent evidence of changes that had happened and looking for, particularly interested in large-scale, significant changes in social care. We were focused on scaling. So not on innovations in the early stages, but on the stage of kind of spread and scale after that, where they'd gone through kind of being used by more people or in wider contexts, in different contexts, different geographical areas, for example. And we focused initially on adult social care. We were looking for examples of innovations that had scaled over that time period, the factors that supported or perhaps hindered scaling, what those were, and any kind of models or frameworks that we could find in the literature, things that helped to understand scaling or put a kind of structure around it that might be helpful for thinking about how things scale in future. We found quite early on that in the time period that we were covering, and when we focused on kind of large scale change, there was relatively little evidence directly from adult social care. So we extended the remit a bit to include health and children's social care as well. So we had a kind of wider range of evidence to draw on. And you can just move us to the next slide, please, Natasha, that'd be great. We split our the factors that we found into kind of two parts, really. So firstly, we had a lot of factors which were operating at the level of the innovation, as we called it. This split was actually based on someone else's work, a paper by David Albury. There's, as we said, this summary report of this has been published today, so you can find that on the website with all the references. So these factors listed here are kind of ones which are operating more at the level of the innovation, so to speak. So it's things that are perhaps more directly relevant for people who are innovating or organisations that are leading innovations, things that are more within their ability to control or influence directly. And then the next slide, if we can move on, has these factors which are external to innovation, so to speak. So these are things that are more relating to the system in which the innovation is happening, to the social care generally. And these are ones which would perhaps be more relevant for people or organisations which are leading innovations, more within their ability to influence, so to speak. But obviously very important for anyone who's actually kind of leading an innovation or part of some kind of innovative service that is trying to scale, to also be aware of, because they are the context in which something's happening. And then if we can just move on to the next slide, please, Tasha. So I won't go through all 20 or so of those factors, because what we did was, while acknowledging that all of those are really important, we identified 7 that we felt were kind of particularly relevant to adult social care. So the first of these is acknowledging and engaging with complexity. So that's acknowledging that social care is complex, not just complicated. It happens in the real world, where people's real lives are there at the centre of it, with all the complexities that that brings. And innovations have to deal with kind of multiple moving parts and multiple elements which are all happening at the same time. It often means there's a kind of lot of uncertainty and ambiguity to deal with when things are innovating, when things are scaling as well. A lot of change going, a lot of multiple factors happening at once. And the review found that you really need to kind of accept that and acknowledge that and engage with that properly. It doesn't work if you try and pretend that it's a simple situation. It is a complicated situation, and that needs to be kind of really dealt with and grasped, which is relevant because a lot of studies of innovation generally say the more simple you can make your innovation, the easier it is to scale. And that's great, but it's not perhaps always possible, or it's something that can be challenging in the context of social care. So it's something to be really aware of. And that relates to the next kind of factor we've pulled out there, which is social care itself being a kind of inherently difficult or challenging area for innovating and scaling in some ways. It's highly regulated. There are many kind of cross-cutting elements: commissioning, funding, provision, regulation, quality assurance, all of those different parts of the social care environment, all delivered or overseen by different organisations, different parts of sectors, some public sector, some private sector, third sector often involved as well. But all of those are kind of relevant, and an innovation is likely to have to interact with all of them in some way or another, particularly if it's a kind of large scale or significant change, the kind of things we were particularly looking at. So that is something that can have an impact on how something scales. If one part of that system doesn't engage or doesn't support the innovation, then that can have a hindering effect. But equally, if all of them work together and if you can bring people together, then you've got a real kind of consensus for change. So that can be a positive as well. Next one there we've got is funding and resources. Probably don't need to explain why that is important, but it's really apparent that certainly the funding for kind of spreading and scaling an innovation can be harder to find than funding for innovating in the first place. There can be funding to get something going, to get it going, but it's still, you do need to have funding resources to get that innovation up to scale as well, and something that is perhaps harder to find and needs to be thought about and planned in from the outset. Impact and recruitment and turnover of staff. Again, probably not news to anyone that social care is a high turnover area of high turnover in staff, but that does impact on innovations and spreading and scaling change. When you're trying to do something new, trying to kind of train new people, if there's quite churn, then that has an impact on that, and it can affect how easy it is to scale something or do something in a new way. Risk aversion was the next one we pulled out here. Very good reasons why social care is somewhat risk averse and people's lives are at stake. It's really important to take account of that. But you know, there are risks involved with change and with innovating and scaling. So when growing and scaling innovations, we found that there should be really open and transparent discussions about risk, and a real focus on the benefits of risk as well, not just the dangers of risk. It's kind of a two-way conversation. Which brings us on to co-production. Another factor that is really important, co-production with people who use services and families, but also potentially with the workforce, commissioners, other groups, other stakeholders engaged. That can really help innovations deal with some of these problems. Co-production is a really good way of finding shared solutions to difficult problems, particularly when some form of compromise is necessary or not everyone is going to get exactly what they would like in an ideal life. So co-production can really help have those difficult conversations. The last factor we pulled out here then is having good evidence. Two main parts to that really. Firstly, being able to demonstrate that your innovation makes a real difference to people's lives. That builds a strong case for change, means that people are more likely to adopt it, get better support and so on. But equally, or well, almost as importantly anyway, is actually kind of having a good record of how the innovation has changed and adapted over time. One of the things we found was that almost nothing stays the same from the start to the beginning. There's always going to be change. There's going to be change to different contexts. When that is kind of well recorded and you can understand why the changes have happened, it's a lot easier to move it to somewhere else, scale it up to different sizes, to understand what is at the core of that innovation, what can be changed and what can't be changed to a local context. So those were 7 factors which were particularly relevant. There's a little bit more about all of those in the summary report published. And if we can just move on to the next slide, please, Tasha. This next slide coming up here is the rainbow of innovations in community-centered support. We just wanted to include that as it's a really good example of a kind of clear and accessible evidence for commissioners, where we were just talking about the importance of having evidence, and evidence as a communicative tool for building consensus and building a case for change. This rainbow is a really good example of how various different kind of innovations and services and so on can work together to support people across all areas of their lives. And then just moving on to the next slide, please, Tash. Lastly, in the review, we also looked at models, what we call models or frameworks to support scalings. So these are things which can help with planning and understanding scaling. We found quite a few in the literature, and there are 4 that stood out as kind of being of particular use for social care. I'm not going to go through all of these. They are outlined in a little bit more detail in the summary report, but what's really key about them is at their centre they have a focus kind of on iteration and adaptive change, so really understanding what's happening with the innovation, learning from that, adapting it to fit the context, and then that helps with the kind of growing process. We felt that these were really useful in 2 ways. Firstly, they often include some or all of the factors that we identified earlier on. So they're in there as part of the model and a reminder to take account of those and think about those. But also, using these kind of frameworks or models can give a real kind of structure, can help predict areas of potential difficulty and provide a way of understanding those areas and how they relate to one another. As we said, you know, it is very complex or complicated, scaling and operating these innovations sometimes. So having these provides a kind of structure to support scaling. So thank you. That's me for now. I'm going to hand us over to Alex, who's going to take us through an example of scaling up an innovation.
Okay, thanks very much, Sam. Ewan, did you want to come back in at this point?
Yeah, no, it was just to say, Sam, thank you very much for that presentation. As Sam has said, the report will be available online in summary form today, but also in full. The full report will be available in a couple of weeks. But yeah, I thought it'd be great, Alex, if you could reflect on what you've just heard from Sam and just apply that to your experience of trying to grow Shared Lives Plus. That'd be really helpful. Shared Lives schemes, I should say. Thank you.
Thanks, Ewan. Yes, so certainly lots that we'd recognise in there. I think for Shared Lives and actually for Home Share, because we look after two innovative models of support, which are both trying to scale, both in different places. We've certainly found that complexity that Sam talks about. And when I first started working with these sectors 10 years ago, we're a provider representative. We're a membership body for all of the local Shared Lives organisations and the local home share organisations. And I really thought that our job was just to help those organisations do what they do really well, do it consistently, and be able to evidence what they were doing to commissioners, and that if we could do all of that, then the rest would follow. And certainly the learning for me has been that it is a lot more complex than that. And I think the thinking that we've brought into the Social Care Innovation Network, which we'll be talking about a little later, is that it's as much about commissioner change as it is about provider change, but actually even more than that, scaling of innovations happens when you have a whole area strategic shift towards a very different way of thinking about social care, public services, and what people are looking for. So that does lead quite nicely into the asset-based area model, because the asset-based area, which is now in its second iteration, started as a blog thinking about those ideas of whole area change and how we think we fit into that, but also I chair the Building Community Capacity Network for Think Local Act Personal, which brings together about 2,000 people now and organisations who are all developing, often from the grassroots, very community-centred approaches to supporting and connecting people. And they were telling a similar story to the one we're telling. They were doing the things that you're supposed to do if you've got an innovation or something that's seen as innovative. Shared Lives has been around for 40 years in modern times. It's not new, but it's still often seen as something that's quite countercultural. Home Share has been around for a similar period of time. They're doing the right things, but they weren't necessarily achieving scale. And some of that can be about business models and evidence base, but it can very much be around, does the local area in which you're working actually want to make a strategic shift in the way that Wigan famously did with the Wigan deal, but also areas like Leeds and York and Thurrock have been doing. And so we tried to look at how could you simplify down that very complex idea of change into some actions that local areas could work on. And so if you're familiar with the asset-based area, it's been around for a couple of years now. You'll see that there are some new actions here which we've developed through the Innovation Network, but you'll hopefully see that they are telling quite a similar story in terms of the overall direction. So the asset-based area model says that if we're really serious about change, we need to start with an overarching story that the area needs to develop with its citizens. What is it that we're trying to achieve here? Because we can all think of areas where there is some really great community-centered work going on, but it comes and goes. It doesn't have huge resource, and it never quite feels central. It feels like the extra, or the work that commissioners wish they had more resource for, but haven't been able to find, because the resource and the time and energy is too tied up with business as usual, effectively. So that clear shared story for change is really important. But then also I can think of areas where if you talk to the leaders there, they will tell a really compelling story about having a different relationship with communities and citizens and doing things very differently. But then it's very hard to trace that through people's experiences at the front line if they're interacting with services or indeed delivering services. So the aim of the actions from the asset-based area is to take that clear shared story through the whole system. So thinking about what money is spent on, what we invest in, who gets to co-design services and commissioning. Personally, I think there's two groups of people who are particularly crucial to that co-design work. The people who use services the most, but also the groups and communities who are most excluded from those services, particularly Black and minority ethnic communities. So not just working with the people who are already accessing what you've got to offer, but challenging yourself more. And then we'll come into some behavior changes in the next slide in a minute, but some of these points are starting to get into how people act, how they feel they can behave. So at work, we can be ourselves, we can connect, we can be creative. And that speaks to what's happening in the middle of organizations, what pressures are being pushed down the system from the top and also indeed from regulators and government. Do people have roles in which they can bring their more human side, their whole selves, you know, be the people that we all wanted to be when we joined public service careers, or do they actually feel trapped within boxes and systems which are very inflexible? And you coming through some more of the 10 actions, they're getting into co-commissioning. So that was a theme of the joint VCSE review, which you can still find online, which was commissioned by Public Health England, Department of Health and Social Care and NHS England, and was a review of the role of the voluntary and community and social enterprise sectors, particularly in the health and care sector. But our key message from that review was very much about shifting the relationship with the voluntary sector away from can we as the state fund the voluntary sector towards a much more shared co-commissioning ideal of actually, if we're all responsible jointly for these resources in an area, how are we going to use them and deploy them together? You can only do that if you are able to plan at the right scale. So a key learning point for me from any kind of change, and particularly from innovation, is it's all about scale. But it's not just about trying to get things as big as possible. It's also about being able to think at a small personal level, at a community level, and recognizing that some forms of change can only happen in communities. And so planners need to be able to think in scales and areas which mean something to people. And then these are all changes which get wrapped up in power. And I think one of the big barriers that we often don't talk about to change and innovation is the reluctance to share and shift, and particularly to give up power. Power often comes in the form of money, but also in the form of knowledge, decision-making power, resources, and who gets to take risks. And then finally, how do you measure all of that? How do you know when you're doing it? So that's sort of a whistle stop through the asset-based area. We're going to continue to develop that through the innovation network, which we'll talk about later. And there's a slide here. I'm sure these slides will be shared, so I'm not going to go through this in detail. But we started to talk with the innovation network areas about how you what behaviours you'd see and what behaviour changes you'd see in an asset-based area. And we looked at 3 different groups of people, but recognized that actually most of us don't fit neatly into one of those categories. We occupy different spaces at different times. But looking at the behaviors you'd see from people with power, from workers and volunteers, and from citizens more broadly, and recognizing that if we want to see citizens changing their behavior, for instance, if we want to see more people volunteering, or more people taking control of their own care and support, actually some things have to change elsewhere in the system. That means that people need to have a different experience of how workers and volunteers interact with them, and those workers and volunteers can only behave differently if they're getting very different messages from the people with power and the people who indeed designed their roles. Moving on, Natasha, thank you. So just to think about the Innovation Network has 3 strands, and I've been talking about commissioning as well as part of one of the key things that needs to change. And you can see the asset-based area kind of model, how it impacts upon ways of commissioning. And as I said, sort of in the overview, that's got to start from a really clear story about what we're trying to achieve. How clear is it that commissioners, first of all, what the purpose of commissioning is? You know, this isn't just about continuing to procure a range of services or procuring them as cheaply as possible, but what are we actually trying to achieve, and is that grounded in people's lives? Does commissioning, is it aware of and using all local assets, not just public money? But of course, is it using public resources well, and able to fit those things together? And what is the role of people who use services and people who miss out in co-producing commissioning? And in the next slide, the Innovation Network's also been looking at self-directed support and messages on bringing self-directed support back to its roots. So even before COVID, we've seen an erosion of self-directed support of the principles and values. And we've seen particularly the erosion of trust. So, and I think there's a real danger that as things have changed during the pandemic, but also in the recession to come, that there will be a temptation to move back to ideas of offering support to people which are much more centrally controlled. And I think instead what we need to be doing is recognizing that in this ever more risky and complex world, actually the only route to improving people's experiences is through co-designing with them and through people's, the support that's being offered being personally tailored to people's needs. And that means flexible human processes, really easy to understand, accessible information. And it does mean leadership, which really reaches down to the front line and which involves a conversation directly with people who use services. And one of the things that's been a real worrying trend for me recently has been the loss of user-led organizations, self-advocacy organizations. And again, I was talking to a self-advocacy organization on Zoom a few days ago, and just hearing about the challenges, as well as actually about the really impressive ways that they've been able to adapt what they do. But we need to make sure we've got that community capital to build on if we want to build back better, as a campaign launched this week was arguing for. Okay, so over to you, Juliet, I think.
Yeah, thank you, Alex. That's really helpful, and Alex and Kate will be talking further about the Social Care Innovation Network shortly. So I'm now going to ask Juliet to tell us about the emerging lessons and directions from the research that she's been leading for the LSC, which is the Supporting Adult Social Care Innovation Project. Juliet, thank you.
Thank you, Ewan. Okay, yes, we moved on already. Great. Yeah, so I'm going to talk to you today about our Supporting Adult Social Care Innovation Project. So, I mean, compared to the other speakers, we are at a very different stage in this project. We're right at the very beginning of a 5-year project. We started late last year, and this goes on to 2024. So, whilst I'll be giving early lessons, it is very much at that early stage, and we kind of are much more in the area of ideas and directions for the research rather than kind of having come up with any answers. So do bear that in mind when I go on through the presentation. So just a bit of the study, I suppose. Oh, before we move on, it doesn't matter. But the aims of the Supporting Adult Social Care Innovation Study is really much, it's very sort of there in the title. It's about building the evidence to support the sector to innovate. By innovate, we're not just focusing at the sort of scaling end, although that I think is really, really important. And it has definitely been an issue, as we've heard back from people when we've been sort of doing some of our early work. But we're also looking sort of earlier on at the stages of development, coming up with ideas through implementation and on to scaling. So yeah, if we can move on to the next slide, Tash. So the study itself is led by the Care Policy and Evaluation Centre at the LSE, of which I'm a part. But it's actually a kind of partnership between several universities, and we also have a number of partners from practice who are really important in helping us to really shape the study, and also as we move through the progress with the project, us kind of interpret the information that's coming back and really make sure that the ideas that we're developing are going to make sense for people and can be implemented and really improve practice and help to improve policy. So I think in the interest of, I'm going to skip over the next slide. Otherwise we won't get through it. So if we move on to, the fourth slide, that's great. So as I said, the core aim of this study is really about building evidence to help the sector to innovate. But one of the challenges that we faced when we were trying to develop this project and think about the direction we wanted to head in terms of, where is it that we should really be focusing on? What is it that's going to, have the biggest impact for the sector and really help us to move forward with this question? Is that, when you look at the literature, when you look at the evidence out there, there's not a kind of clear place that you can go that will tell you, this is what we know about innovation in adult social care. This is what we don't know, and therefore, this is where we should focus. It's difficult to find that. The literature is really quite dispersed. It's very disorganized, really. And there's also this kind of sense when you're reading through what is there, that there are potentially these quite large gaps. And just really picking up on areas that are perhaps of real importance to policy, to practitioners, to people really trying to implement and drive and sustain and spread those innovations out there. So we felt what we needed to do in this kind of first year of the study was really engage with stakeholders in the sector, really try and understand what it was that they thought were the kind of key issues, and to bring that together with this kind of disorganized evidence base, I suppose, in a way, and identify these key areas that we want to focus on for the study in order to really help support the sector, as I say, to innovate. So in terms of this sort of stage of the research, what we did really is, I've kind of drawn out some of the stages that we've gone through. There's really been a kind of two-stage process. We've been guided in this stage through a couple of questions which are outlined in that blue bubble. But I'm going to focus the rest of the presentation today really on the first phase of the data collection that we've done so far. So from the kind of mapping of stakeholders, informal discussions that we've had with people, and sort of gathering the database of innovations, we've come up with a sort of preliminary direction for the rest of the study. But we do realise that we need to do quite a bit more work to really kind of pad out those ideas, really understand, what they mean for people, and really kind of ground them in the theoretical evidence that there is out there. Sorry, if you just want to do there's the next point. So, I mean, one of the things that has also happened during the study is COVID came along. So we've been slightly having to reorganize this second phase of the research and how we frame it in order to help us really understand the implications of COVID for the sector, and how that might have changed and reshaped really the context for innovation, just to make sure that the direction we're proposing to head in for the case studies and for surveys that we'll be doing later on in the study really makes sense for the sector, and is, as I say, going to bring the kind of most benefit from the research that we're doing. Okay, so I thought the kind of the first aspect that we kind of looked at when we were trying to address this kind of first question really of what do we mean by innovation in adult social care and what is it for, is that you find people expressing a kind of whole range of ideas and reasons and rationales really for why innovation is important in adult social care. And people often are taking a slightly different stance. It's quite interesting to see on different questions, and different stakeholders will put forward and emphasize these kind of narratives slightly differently. So if you think about the kind of issue around the inadequacies of the system around well-being, some people might frame a slightly more of a empowerment perspective, and others will perhaps take more of a sort of safety perspective on that. So I mean, in some ways, this is quite an obvious point. I don't think this is not groundbreaking, but I think the reason why I want to emphasize it here is because when we think about there being multiple perspectives driving something, that means that there's politics involved. And it's really important when we're thinking about the kind of framing of how we think about innovation and study innovation in adult social care, that we're really aware of all of those perspectives and the kind of politics that there is around this question of how we innovate and how we improve innovation in the sector. So I think the other interesting point that comes through when you look at these kind of different narratives that there are around innovation, and when you start to kind of look at what's happening in practice in terms of the innovations you see out there, is first you see that there are just a ton of different innovations. You know, if you dip your toe into the water of looking up all the innovations that there are in adult social care, you know, it's quite hard to not come away with a sense that there's just this absolutely dizzying array of options there for people, and also this sense that, you know, quite a lot of them seem to be operating in very similar areas. So they have a slightly different take or a slightly different way of implementing what seems to be quite similar ideas. There's also, you know, there's a sense of kind of duplication, I think, and a lot of people express this to us when they were talking to us about innovation. Some of that's around kind of branded products, but some of it's also around there being sort of lots of homegrown examples of innovations that, as I was saying, kind of tap into sort of similar ideas. And I think this gives you this sense that there's quite a lot of sort of disconnection in terms of what's going on in innovation in the sector. There's lots of things going on, but they don't really seem to be kind of joined up. People perhaps aren't speaking to each other. And I think this is something that's quite important for us to understand and to try and investigate. And the other thing that comes across when you're kind of talking to people
I think we might have lost Juliet there for the moment, guys.
Understanding where they see innovation going in adult social care is that you also find this kind of grand. Oh, sorry. Can you hear me again?
We can.
Can you hear me? Yes? Okay, you can hear me. I was talking about grand narratives. I don't know how much of that you got. So yeah, so what you see is that, you know, people kind of connect up all these different ideas. So there are inadequacies in the system. We need a more sustainable system, and therefore what we really need is a kind of a new model of care. You see this being put forward as the kind of solution. And I think it's something really interesting in that idea. It speaks the kind of systems to people with housing end, to people at the more health sector end. So it's quite an interesting concept. I've got a kind of question mark that will sail in at some point. but if we just press forward, there we go. But the kind of question for me, I suppose, around the new models of care is the extent to which you're actually seeing that in practice. Alex was mentioning the Wigan example, Thurrock examples. There are some examples of this new modelling models of care perhaps being more than an idea, but it's something that's quite, I think, important for us to explore in a little more detail. So the next area that we've kind of tried to approach, we said we would develop a typology of innovations, and this is really our sort of first attempt at that, to work around it. So I'd be interested in hearing your kind of feedback on this area. But as I said, that, you know, there's just tons of innovations, and we were trying to kind of bring order to them and think about, you know, are they trying to do similar things, and how can we describe that? So the first type of innovation that we sort of have identified are those that we describe as more sort of repairing innovations. So this is the idea that they're kind of addressing gaps in the current system, perhaps around kind of a need or preference that's not really being met by either the market or indeed the public sector. You often see these really at the kind of non-statutory ends, perhaps at transitions for specific groups of individuals who have specific needs that aren't just met very well by the system. The other area that we've identified innovations is those that we've called kind of modernising. So these are innovations where people are kind of essentially trying to keep up with the times, both in terms of tastes and those changing, and also in terms of the environment changing. So they're often about improving performance and have some kind of sort of re-engineering type logic, improving pathways, processes to them. And they tend, as you can see from the examples that I've given, to be quite tech-driven. So the third one that we identified, and this is quite different from the other two that I mentioned, which are much more at the organizational level. So the reconfiguring innovations, by contrast, are much more at the kind of system or supra or intra-organizational level, but they're much more around kind of redefining relationships between organizations, often in terms of the responsibilities for certain activities and with implications for kind of the governance really and those relationships. So you can see, you know, spin outs, local authority trading companies are a good example of that. Anything changes around commissioning, again, would have implications in that area. So then the fourth type of innovation is a transforming innovations. And we put these in the middle because it seems that they kind of capture all of these logics. They're trying to do a little bit of all of these things, operating at the systems level, at the organizational level. And importantly, they're also involving all the different sectors. So whereas when you look at something like the repairing innovations, they tend to be, and I'm, you know, grossly oversimplifying here, they tend to really be directed to the non-statutory end. They tend to be driven by the third sector. You know, and when you look at reconfiguring, these ones are often more from the public sector end, but when you see the transforming, they're across all those sectors. They're involving all different groups who are trying to operate at the non-statutory, at the statutory. We're really trying to change that whole system. And as Alex was saying earlier, you know, really our way of looking at care and what that means and how we deliver it. So the other thing that I think is quite interesting when you think about these different types of innovations, I've got like little, I don't know, animations that pop up. So we'll come at some point. But yeah, there we go. For the repairing innovations, the other thing that I think is quite interesting and quite important, in particularly when we think about, you know, how we study these and how we understand it, is that the repairing ones are often very much associated with ideas and social movements. That's kind of comes across quite strongly. Modernizing, as I mentioned, is much more around tech often, and the reconfiguring, there's often a link to policy there. Indeed, some of these just can't happen without changes in the law or, you know, policy direction of some manner. So the transforming, as I mentioned, I think these are where new care models sit. As I said, you know, perhaps some issues around whether we can recognize these actually happening in practice and learn from them. But I think the key thing I really wanted to emphasize here is the idea of fragmentation. So there are these kind of different logics. There are innovations happening in different areas, driven by different people with different perspectives, with, you know, different goals. And the literature reflects that. And the way people have thought about innovation tends to be sort of associated with these particular areas. So we've looked at third sector innovation, we look at public sector policy innovation, we look at, you know, sort of more of these modernizing or private sector statutory innovations. We tend not to look at it as a whole. And I think the real challenge for us in this project is how we can try to do that, how we can try to bring these areas that often don't speak to each other together in order to provide lessons for the sector more as a whole, rather than this sort of disaggregated way that we've seen to date.
Okay, Juliet, just wondering, just worried a bit about time. Is it possible to move on fairly quickly?
this is the last slide. I won't talk much about it. So this is really telling you the direction. So in addition to the point I've made about new care models, it's something we want to look at. In addition to the issues there are around COVID and how that's perhaps changed the ground, there are sort of 3 areas that have really come out from the work that we've done so far in thinking about where we want to focus for understanding innovation and understanding how we can better support the sector to innovate. The first is around these capabilities for innovation. When we spoke to organisations, there was people talked a lot about working with other organizations to help them with the design, with co-production, with implementing change. There's something there around, the extent to which these capabilities are out there in the system, the extent to which they can be brought in, the extent to which they're accessible, and, how these capabilities are actually helping the sector to innovate or not. Where are they important? When are they important? So that's one important area. The second one is around resourcing. We've already mentioned this. So I think in some ways I'm just repeating what's here before, but I think we've tried to connect it here to the concept of a value proposition. So it's not just about how you resource the innovation and at what stages and, getting it beyond and so on, but it's also about how you communicate the value of that innovation more broadly. And then the challenges perhaps of that in the context of the sort of political aspect that I mentioned, the context of, these more conceptual, sort of broader ideas-based innovations that, are perhaps value-led, and also the sort of transformational innovations. And then finally, and again, I think this speaks to a point that Alex was making, the relationships and the need for collaboration has come through again quite strongly. And one element that's been particularly interesting is we've sort of thought about the knowledge mobilization and the spread of these is the role of kind of what we've called sort of supra-organizational structures. So the sense that some of these innovations are connected through networks. And I think particularly in the context of the statutory sector, there are, these super-organisation umbrella organisations that really do have quite an important role in communicating and some of these ideas, and also with respect to the issue of power that was raised. There are questions that it would be important, I think, to explore in terms of thinking about how you move a system that is operating within a particular mode and allow these kind of challenging ideas to surface what that means in terms of power. So I think that's it from me. There's just a final slide telling you how you can find out more about the study, have your say. Do get in touch if you've got any ideas and about where we should go, and there's just some ways of staying in contact with the project to hear about our ideas as they develop. So thank you. And sorry for going over.
Thank you. No, thank you, Juliet. There's some shouting in the background in my house, so I do apologise for that. So just finally, we're going to talk again about the Social Care Innovation Network. I'm aware of the time, and I think it'd be really good if we could ask Kate Sidthorpe to contribute her views to what she thinks helps bring about innovation. So there's plenty of information on our website. New products and tools and resources have been published last week on the Innovation Network. So we won't go into any major detail on this, but just ask Kate maybe to finish off with her perspectives.
Okay, hi everyone. My name's Kate Sidthorpe. I'm a member of the National Co-Production Advisory Group. And we're a group of diverse people from across the country with a whole range of different life experiences. And we work with Think Local, Act Personal. So I've been asked to give a few thoughts about the citizen perspective. So Tash, if you could go to the slide about the role of the citizen. I think it's a couple of slides on. So while you're finding that slide, so I think of the citizen, and I access services myself as a carer, but also my daughter has learning disabilities and autism. And so she accesses services. So my question to sort of all the other speakers really, and to you guys out there, is how can you be sure that your innovative idea is going to deliver what matters to people? And it's sort of an obvious question, and production, but to me, that's why co-production is so important, and it has to underpin absolutely everything. So co-production is, it should start from just the first flicker of an idea. So you might know about a service or community approach that works really well in one part of the country, and you think, you know, it'd be great if I could introduce that locally, but you have to ask, will it work? And the only way to do that, to find out, is to talk to local people, because what works in one area won't necessarily work for another. So, for example, one of our carer groups, they told us they'd set up a bingo group for carers, which worked really well in Crewe, in Cheshire, where I live, but it didn't work in Wilmslow. So different people want different things. So the only way to find out is to talk to people. And I think often if you do talk to people, the seed of good ideas from people themselves. So if you don't co-produce, you're going to lose the opportunity to come up with the best solution. And also it's really important, I think, to talk to the people who deliver services face to face, because, you know, quite often I think managers and leaders in organisations can be a bit removed, but those people will also have really good ideas about what's going to work. So I've talked about time and space, and that's really important. So people need time to come together and space to come together to create something new. And I think many individuals and many communities are rightly sceptical about organisations and services because of the experiences they've had so far, and services not always being what they're looking for. So if you can have open conversations and build trust, then people will be able to talk to you openly about what really matters to them and share their ideas. And I think from the citizen perspective, looking at the asset-based area, I think it's really, really important to connect to the wider community, because you need to discover what people can do out there. So people have all sorts of skills and talents, and if you can harness those, then I think your work is more likely to be sustainable and more likely to be successful. So I would just say, talk to the people who are likely to want the service or the project that you're creating, and you need to establish the demand for what it is you're going to create and understand the nature of it. And it's really important, I think, to think about equality and diversity and how you can be inclusive. So many of the innovative projects I come across do really well because they're inclusive. They're linking across generations, they're linking across different backgrounds. And for me personally, I think the world's a better place when it's diverse. And then I was just thinking about making mistakes, and being prepared to own the mistakes that you will inevitably make. We all make mistakes, and we have to give each other permission to fail, whatever your role is. So it might be that you're setting something up, or you're going along as somebody accessing a service. We're all going to make mistakes, and those mistakes are opportunities to learn, but it all comes back to relationships and communication. So have conversations about what's gone wrong and build on your shared values, and be just determined to keep going to create something better for the people who are relying on the service. So for me, the role of the citizen is being willing to talk, willing to share your ideas, to dare to trust the organisations that you're working with, and within that to focus on solutions and be up for trying things out. And also to absolutely think about the people who aren't part of the conversation and the planning, people from minority groups. So next slide. Are we there? Are we? So they were just my my thoughts. I also wanted to share with you Making It Real, which is a fantastic tool that's been developed by Think Local at Personal. So if you want to get better at delivering support and care and services that are really person-centered, then Making It Real is for you. It contains statements written from two perspectives. Statements are from the perspective of people who access services and we statements from the perspective of people who work in services. They describe what good person-centered care looks like. And the way to use making it real is to have conversations with people who access your service, people who work face-to-face, your leaders, your managers. It works at absolutely every level. I know time's short, so I'll just say look on the TLAP website, you'll find loads of information about it. And if you do want to use Making It Real, we'd really love to hear about your experience. So back to Ewan for questions.
Thank you, Kate. And what an important plea that is to involve people during the entire process of creating an innovation, but then also scaling that innovation. That seems like a vital lesson from all of the literature and all of the examples we've explored on this webinar. Right, so are there any questions? Steve, I think you're going to try to share some questions with us so that we can.
Two or three people asking whether the slides are going to be made available. Yes, they are. Usually we say within a sort of couple of weeks, but sometimes it's a lot quicker than that. So that'll be on the page. If you signed up via the SCIE Social Care Institute for Excellence website, then you will be getting an email about that at some point. Somebody asked, they were late in, and what's the report out today? Well, it's I think the one you're talking about is a scaling innovation in social care, a rapid pragmatic evidence review, summary report, and we've created a tiny URL for it. So if you want to write this one down, it's www.tinyurl.com/SCIE/SCIN. So it's as Social Care Institute for Excellence, Social Care Innovation Network. So I'll say that again, www.tinyurl.com/SCIE/SCIN. Quite a few questions through, but I'm aware of time, so it's worth mentioning that just perhaps a couple. Katie says, as a care home manager for, it says here, elderly residents, what is the most important point I need to take from today's webinar? And then John says, Cormac Russell describes it well when he says, instead of asking how you or your organization can create more value to or for your community, ask how you can create more space for the community to create what they value. That might be all I have in terms of times, but I don't know if anybody from the panel wants to react to any of that.
Please go ahead.
I was trying to see if there was a link between those two things. I think some of the innovations that that I've seen and been most impressed with within the care home sector during COVID have been about the ways in which people have either forged or built on relationships with the wider community. And there are, I think, too many care homes which feel very separate from their community, which haven't really got links, which are places people walk past and maybe don't think about too much. And then there are some care homes which have really been imaginative about how they break down those barriers, share space sometimes, which obviously you can't do at the moment, but actively build links with the community. And we've all found out just how much we need those links in the last few months.
Thanks, Steve. Look, I've clearly not chaired this fantastically well because I think we should have left more time for questions and answers. So what I will endeavour to do is to look at the questions that have come in, and I will we will post some answers to those questions after the webinar. It was just so difficult to stop people telling us about such interesting examples and projects. So I apologise for that. So we will send around some answers to the questions that have come in. I'm aware that we are now time is now up. The webinar didn't crash. We got through it, which I hope was helpful to everyone that was listening. Thank you very much for taking the time to take part. Thank you to all of our speakers, and we hope to see you all again very soon. Thank you very much. Bye now.
Thanks, everyone. Bye.
Thank you, everyone. Thank you. Goodbye.
Okay.